Do we have the stupid CDC engaging in spreading some public viruses? No, not the one that's obvious. They've just got some news aids out here right now. CDC deems racism a serious public health threat. Yes, so they can go ahead and tyrannize your lives based on something that is unquantifiable, based on something that you can't fix, at least according to them, because it's all systemic, right? That it's racism is as American as apple pie. I forget who said that, and I'm better off for it. Perhaps Joe Biden can get his daughter, the social worker, right? The one who was pulled over by the cops and didn't have to fear anything. This is the dumbest fucking story from the debates, but yeah, remember, the reason she got away with just a speeding ticket or whatever it was, not being accosted by the police officers, was because that she was white, and definitely the Biden surname had nothing to do with it, I suppose. It's kind of like how Hunter can just, purchase a gun, lie on the background check, and just, here you go, sir. Oh, pardon me, before you leave, you dropped your crack pipe. We know it's yours. It's the one with cheese on the bowl. Center for Disease Control and Prevention deemed racism a serious public health threat according to an entry published on the agency's website. The entry titled, "Racism is a serious threat to the public's health. The agency asserts racism is intrinsically intertwined with public health matters." Of course it is, okay?
Growing body of research shows that centuries of racism in this country has had a profound negative impact on communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays, and creating inequities and accesses to a range of social and economic benefits such as housing, education, wealth, and employment. These conditions, often referred to as social detriments of health, are key deliveries of health inequities within communities of color, placing those within the populations at greater risk of poor health outcomes.
That's a scientist accent. Hopefully you like it. I know I don't. The CDC cites data suggesting racial and ethnic minority groups experiencing higher rates of health conditions, including hypertension, diabetes, I got the beatus, and heart disease when compared to their white counterparts. Additionally, the life expectancy of non-Hispanic Black Americans is 4 years lower than that of white Americans. The COVID-19 pandemic and its disproportionate impact among racial and ethnic minority populations, cite the source, is another stark example of these enduring health disparities. Okay, what are you going to do? Okay? You have this growing body of research. Care to publish it? Care to show any of your findings? No, you can't? Okay, cool. We'll just go ahead and talk about my racism more and more. That'll probably work if you just keep on saying it over and over again. Eventually, you'll get to the point that you want to make. Okay. Why do minority groups have a higher rate of hypertension, diabetes, and heart disease? Do you want to address the actual foundational problems, or do you just want to bitch about the outcomes, okay? Do you just want to make them your little pet projects? Maybe you guys are the racists after all. I know it might be a little bit of a stretch and definitely not a point that I've driven into the ground for a very long time, but if you want to talk about that, maybe it's not racism. Maybe it's just like Joe Biden said about the Chinese and the Uyghur death camps. Maybe it's just a cultural thing, right? Maybe it's the fact that obesity rates are also a hell of a lot higher in minority populations. Kind of left that one out very conveniently, right? And most, if not all, those conditions that are listed there, hypertension, diabetes, and heart disease, can be controlled, can be remedied, can be mitigated through weight loss, through exercise, through improved diet. My God, how many things? You would be shocked how much shit can actually be cured, controlled, mitigated, improved in your life by just stop eating out of a box and eating out of a bag. It's fucking astounding. You start eating stuff that looks like real stuff. What do I mean by that? Okay. You have these real fucking 300 IQ takes. It's like, oh, I got these new chips and they're made out of seaweed. Aren't they great? Okay, what's in there? Oh, it's seaweed. They're great. You look at the ingredient list. You got corn flour. You got maltodextrin, artificial colors. Oh, but it has natural flavors at the end, which is just a catch-all term for just little improvements. Oh, yes, and yeast extract, which is just a covert name for MSG, by the way. Spoiler, monosodium glutamate. So if you see that on there as well, that's also pretty much anything with a 8 at the end of it. Yeah, probably don't want to be ingesting it. Just a little word from the wise. No, you want to, if you're eating anything out of a bag, right? It should have less than 5 ingredients. That's just a good catch-all rule. And it should look like what it says that it's made out of, right? Like a salad tends to look like a salad. Lettuce, it doesn't have to be processed. And juicing is one of the biggest scams in all of the health world, right? What's in there? Oh, okay, I got all these 5 fruits, but then I got some kale. Oh, okay, you pulverize the kale, so all of the fiber that's in there is not in its natural form, and it doesn't perform the same in your body after it's been processed, because it doesn't matter if you blend it, you can cook it up, and then your nutrients just leave through the process of heat and denaturalization. And then another thing that's not on there, it's like, oh, okay, yeah, one of their solutions is probably, oh, you just give them more money and they'll have fucking better decisions to make. Obviously not. They won't have to eat all of that crappy food because of a Big Mac. Yes, because I haven't had fast food in year is it? Like 15 years at this point. Let's just say what a Big Mac meal is probably $10. I think probably. What can you buy for $10? Well, you can go to a grocery store and stop consuming shit from a fucking convenience store where they price jack, what, 30-40%? Stop going to the corner bodega. Oh, you're just going to support local businesses? No, sometimes the supermarket's probably got you covered. You can go to a fucking farmer's market, and those are better prices anyways, and that, you know, is not covered in a whole bunch of shit. And then you can support local businesses, not ones that purport to source all of their groceries and they source all of their products from local means. No, I'll just go directly to the producer, thanks. I won't be taking your line of horse shit. Instead, I'll get the stuff that was grown from the horse shit. No, you take that $10, you buy the stuff, you buy the chicken breast, you buy the frozen chicken breast, you buy the frozen vegetables. You can make $10. You can make that a daily trip to the drive-thru. Because you think, what? Okay, yeah, your average meal, you work 5 days a week, and you go to your fucking drive-thru. That is what? $50, $60, $70 at the end of the week. I can just tell you, you can buy a couple of boxes of spring mix. Even in Grand Prairie, our prices are ridiculous. They come out, they're $5 a piece. You buy a box of chicken breasts, those will last you for a month, and they're like $30 for a box. So what are you up to now? Up to $40. You can have a dressing, you can have some oil. Okay, yeah, a bottle of oil that'll last you for a month or two. That'll be $5 for some extra virgin olive oil, or you can get some avocado oil. If it's on sale, it's 10, or it could be 15. You can cook up the chicken breast in the oil, or you can just drizzle it on top for some flavor. A little salt, a little pepper, you're fucking golden. You know, it won't taste as good as that highly processed meal, but at the same time, you are saving so much goddamn money, right? Even if you were to buy some new plastic cutlery or storage equipment, you would be saving yourself so goddamn much. But people are lazy and they'll make up any excuses, and that's the entire point of this, right? Oh, okay, we're going to call racism a public health emergency because people don't want to take personal responsibility for their own actions, obviously, right? But that's the CDC's answer. They'll call anything a serious public health threat. Like COVID is still a serious public health threat, right? Even though everybody knows the numbers at this point, and it's just not panning out anymore. And here's something that I can probably only read directly. I don't know how much information, because stuff like this is getting people yeeted to left, right, and center off YouTube. So I wanted to inform you guys. And here's a straight read from the New York Post. Side effect that Johnson & Johnson vaccine caused at Colorado site. 11 people who suffered adverse reactions to the Johnson & Johnson vaccine, prompting the closure of a vaccination site in Colorado, experienced symptoms including nausea, dizziness, according to health officials. 2 people within the group were also taken to the hospital for further observation, the Denver Post reported, citing a public statement from the Colorado Department of Public Health and Environment. The 9 others were treated with juice and water, state officials said. The health department stressed that the side effects experienced Wednesday were consistent with what can be expected with the one-shot dose. It said the decision to close the vaccination site at Dick's Sporting Goods Park, or are they fucking firing it in with a tennis racket? Park in Commerce City was made out of an abundance of caution. Where have we heard that before? The state has no reason to believe the people who were vaccinated at Dick's Sporting Goods Park should be concerned. Yeah, I've been told that this is 100% a effective and safe vaccination, and it definitely doesn't lead to any sort of long-lasting effects. And we know that for certain 100% because YouTube tells us so. And that's according to the WHO and the CDC itself. And we all know how viable the opinion of the CDC is. You can believe me on that. Disregard the first article that we looked at. With that said, guys, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.